Hello, everyone. Greetings for the day. I'm Sayukta from beautiful Spotless Skin team, and I'm sure all of you must be keeping good health. We all know taking good care of your skin is important for more than just your appearance. As the largest organ, your skin becomes the most essential to your overall health. If you take care of it, it can help take care of you. This is why it is so important to have a well thought out skincare healthy routine. According to a study conducted across 4 Indian cities, reveals that more than 80% of the Indian population presents skin color heterogeneity on the face, irrespective of age and gender. This heterogeneity mainly results from hyperpigmented spot and melasma. Indian skin tone is more susceptible to pigmentary disorders. It occurs mainly in women, 90%, and 10% of males of all ethnic and racial groups. Around 20 to 30% of 40 to 65-year-old women present a facial melasma. It is pretty well known fact that you will feel better when you look better. Having a daily skincare routine helps you to look your best and put your best foot forward when you go out into the world. In today's busy world, cosmetic products are an integral part of our daily lifestyle. But are they healthy for our skin? So let's connect today with our skin expert, Dr. Milan Jhavar Kabra, live from Indore, to enlighten us on skincare treatment and melasma and hyperpigmentation. Dr. Milan is a very young, vibrant, and highly skilled in the field of dermatology. Doctor has completed her MBBS from Government Medical College, Baroda, and post-graduation MD DVL in Dermatology from Government Medical College, Bhavnagar. She has completed her fellowship in aesthetics and dermatosurgery under the guidance of Dr. Yogesh Bringradia. She has a personal interest in core dermatology and procedural dermatology. She has good communication and counseling skills, which makes her a skillful dermatologist. She is assistant professor in Department of Dermatology at Index Medical College, chief consultant dermatologist at Choitram Hospital, Indore, and director of Dr. Kabra's Ortho and Skin Clinic, Indore. She has various publications in international and national journals. She is trained in dermatosurgery, which includes nail surgery, scar revision, mole excision, and so many other things. She also holds expertise in laser and various aesthetic procedures as PRP, microneedling, peeling, etc. It's such a pleasure to have you with us, Dr. Milan. A very warm welcome to you.
Thank you, Sayukta, for this very nice introduction.
So, Doctor, today we are going to talk about melasma and the management of melasma. But before that, I think it's important for us to understand what is melasma. Please explain.
So, melasma is a kind of hyperpigmentation. So, what do you mean by hyperpigmentation? Hyper is more, and pigmentation is color. So, that means more color to your skin. And it is mostly commonly found over face, which is bilaterally symmetrical. That means you will be having two patches of hyperpigmentation over your cheek, your eyebrows, or your upper lip over your nose as well. So it is a very chronic pigmentary disorder.
Right. And I think it's so common, especially in our society, especially in our country, especially in women. We see a lot of women with facial melasma. What are the causes of melasma, doctor?
Okay, so let me start from basic. What are the causes of melasma? First of all, right. In India, the tropical region, we are prone to lot of sun exposure. First cause is sun exposure. And in sun exposure, the causes are UV light exposure, infrared, as well as blue light exposure, which we get from all the screens, laptops, or TVs. So the second cause is hormonal. Therefore, the women are more prone to melasma. So hormones are the estrogen and progesterone. The third one, people taking drugs which contains these hormones. So these are oral contraceptive pills. Also, it is associated with thyroid disorder. It can be genetic as well, as it runs in family also, a very less percentage. And also, during a study, we found that women with iron deficiency anemia, what it means, the low level of iron in blood. So these women are also prone to melasma. So these are few of many factors which are causing melasma.
Right. So a lot of reason could be, responsible for melasma. Initially, you said that melasma is a kind of, we can say it's an hyperpigmentation. Now, the thing is that pigmentation or hyperpigmentation is a term which we are very used to of, listening. So कुछ भी ऐसा फेस पे दिखता है तो हमें लगता है हाँ ये पिगमेंटेशन है, लेकिन melasma क्या उससे अलग है? मतलब what is the basic difference between melasma and hyperpigmentation, doctor?
So as I told earlier, hyperpigmentation is hyper means zyada and pigmentation is color. So it is zyada color. So it can be there be many causes for zyada color, that is hyperpigmentation. So it could be anything like tanning, which we get from sun, as simple as that. But melasma, what it is symmetrical nature. Symmetrical means it is present on both the cheeks, both the eyebrows, both the upper lips. Usually presents in 30 to 40 years of female. Also, it is present in male. Hyperpigmentation, if you get an acne spot or anything like that, there can be a mark over your skin, which will be a very tiny mark of a certain color. That is hyperpigmentation, melasma, and hyperpigmentation. So all melasmas are hyperpigmentation, but all hyperpigmentation may not be melasma.
Right. So all melasma hyperpigmentation, but all hyperpigmentation, of course, can be melasma. Now, the thing is, though you have explained in bits and pieces the signs of melasma, but other than that, if we talk in particular for a layman to understand, are there any symptoms or just the signs of melasma? And if, what are these?
It is a very easy diagnosis. Like patient comes to us with diagnosis, like I have melasma, do it, like what you can do about it. So it is a very layman diagnosis to do. It is a chronic disorder and it is also called as mask of pregnancy. So pregnancy is a risk factor for melasma. So it is a very simple diagnosis, like no brain.
No rocket science behind it.
Yes, nothing.
Just by looking or the physical, appearance, you can make out that this is melasma. Okay, you said that pregnancy is one, or the pregnant women are one of the risk factors for melasma, right? They are at risk for melasma. What are the other risk factors for melasma, doctor?
They are also caused by the causes. So I have told earlier, such as women taking oral contraceptive pills, having a lot of sun exposure, working continuously near infrared rays that are our gas or chula, which is present in our kitchen. Patient not using sunscreen. So these are few risk factors for melasma. And also one point I want to add, pregnancy, as we know, it is a risk factor, and we know that 50% of Indian population are females. They will get pregnant sometimes. What can they do to prevent melasma?
Yes.
So it is regular, continuous application of a good sun. That is all we can do.
Good sunscreen.
Yes.
Okay, so sunscreen is that important in preventing
pregnancy as well. Yes, pregnancy safe.
Right. Now, what happens during pregnancy? Many a times we can't prescribe them some, just any oral pills or medication or ointment, etc. So sunscreen is one very good way of preventing melasma during pregnancy. Fair enough. And as you were elaborating the causes and also those who are at risk for melasma, it looks like only women are one who, get melasma. But I'm sure men also get melasma, right? Initially in the introduction also, I was saying that overall, okay, very limited % of males get melasma, but then they do. What are the causes in males for having melasma?
Not typical causes which contains hormonal causes. So there is a lot of sun exposure and genetics. These are the two causes for males. They are quite relatively easy to treat because they do not have the hormonal component.
Right. And because it could be genetic, or if I have a family history, does I have the risk of getting melasma?
Yes, for sure.
Okay.
You have a risk of the little amount.
Okay, so family history matters. Yes. In case of melasma, right? And again, how to prevent that in case I have it, in my family? How to prevent melasma?
Prevention only contains sunscreen, and then you can do nothing about it. Not only sunscreen, I would add physical measures of sun protection. So what are those? We'll have to cover our face. We'll have to wear clothes which are full bodied. Then we can also use a wide brim hat when we are traveling or when we are like doing some outskirts activity. Also, some women say, I do not travel or I do not go outside my home. So why do I need to apply sunscreen? So even if I sit near a window, even if I travel through car, sitting in a car, even when I am at snow area where snow is there. So these are all things where we need to apply sunscreen, even on cloudy days or winters as
well. Okay. So because sunscreen is so important for the prevention of melasma, we would like you to shed some more light on sunscreen. You said that, even if we are at home or traveling in a air-conditioned, vehicle or something, we normally feel that our exposure under the sun is very less. So why should we apply sunscreen? B, if I'm working from my house, if I'm working in front of my device, I'm sitting in front of my laptop or my mobile, etc., or under the LEDs, are they equally damaging to my skin or can cause melasma?
Yes, they are. From the screens, we get blue light. From heat or from stove or gas, we get infrared radiation. And from all the other things, we get UVA, UV, and UV light. So these are all causing damage to our skin.
Right. So even if someone is working in the kitchen for long hours under the, stove, etc., they are equally prone to sun, not exactly sun damage, but damage from the harmful rays emitted through. Right. And thus sunscreen is that important. But whenever we hear of sunscreen, people have n number of complaints or excuses for not using sunscreen. The fact remains that in India, many less people are, using sunscreen religiously. They'll have complaints like I sweat a lot, or my skin becomes very patchy, or oily, or it may make my skin look very dull if I use sunscreen. So a number of excuses are there, complaints are there regarding sunscreen. What's your take on all these reasons?
First of all, what we used to do at our clinic is we got samples of few sunscreen types, like this is a lotion, this is a tinted sunscreen, this is matte finish sunscreen. And I usually tell my patients that these are the good sunscreens available for you. You can try the texture, and which feels good, then you can go for it. Like so, the patient will accept the texture and then will be committed to it. Second, the frequency of applying sunscreen, it should be minimum a duration of 3 to 4 hours between two applications. So it is usually we say it 9, 12 and 3 baje the patient has to apply it. The third thing is amount of sunscreen. So amount is the 2 fingertip rule, which I guess we have been taught very nicely. That the patient has to apply sunscreen. Take the sunscreen from this area to this area, and such 2 fingers has to be applied over the face. Dot has to be applied and then has to be slightly rubbed over the face. So these are the few tips to apply sunscreen. And third thing is continuous application. Means we do not need break. It is a second skin. Sunscreen is a second skin. It should be a second.
Sunscreen is to our skin what clothes are to our body. So if we have the time of wearing clothes, then we should, manage to apply sunscreen religiously. So application, reapplication, amount of sunscreen, all this matters. And as you said that, various formulations are here. So we can choose sunscreen as per our skin type, as per our, day-to-day activities, etc. And we can also take help of a dermatologist who can help us choosing the right formulation for us. But then when we go out to buy a sunscreen, there are so many sunscreen. I mean, medicated sunscreens are there. Then, cosmetic sunscreens are there. Then cosmetic products or makeup products containing SPF is also available these days. Plus, there are so many information in the box. There is SPF, there is, so many things. What are the basics to look for whenever we are going for a sunscreen, doctor?
First of all, I would like to add that please leave it to your dermatologist. Go to them, enter their chamber, ask them that this is my skin, I do this type of activity, my exposure time is this, please suggest me a sunscreen, and then stick to that sunscreen and please apply it for your life. Second thing is, if that is not feasible, if you cannot visit a dermatologist, then you can use certain data, that is SPF should be 30 or more. For melasma, it should be almost around 50. Tinted sunscreen is a good thing for melasma. That means it contains iron oxide, which is useful for visible light as well. And other thing is water resistant sunscreen if you are a very swimming prone person, or you live where the climate is rainy. But other than that, I would still suggest please visit a dermatologist and decide. Like, let the dermatologist decide what
Correct.
sunscreen you should.
Correct. What happens, we waste a lot of time, energy, money in experimenting and trial and errors, and we end up buying so many, but none of them, looks like useful for our skin. So it's always good to go to the dermatologist at the right time. So whenever you think that, okay, this is the time I need to go, and every time is the time. And when sunscreen is, as the doctor said, the second skin. So please go and visit a dermat.
Yes, there are a lot many number of reels available over Insta, over FB. Like, they will be explaining you use this, use that. Cut it short and give it.
Right. And, not just for sunscreen, even because we are talking about melasma, we are discussing melasma, or for pigmentation, there are so many over-the-counter products. There are so many so-called home remedies, the nuskhas, and there are so many influencers as well these days telling a lot of nuskhas. So what's your take on these home remedies or over-the-counter medication for melasma?
Now, for longer time when we were kids, there was the cream available. There were many creams available with the fair name written over the product. Earlier, so much evidence, but now we have the product contain a very harmful chemical, which is also called, which is, I would not like to mention, but it is a chemical which causes more damage than repair. So, over the time of 10 years, patient using it continuously, they will get lichen planus pigmentosus or other kinds of hyperpigmentation. Few chemicals which dermatologists prescribe have to be used under their guidance, like for 3 months, alternate day, only for an hour, or only for 2 hours. These advices which the dermatologists know will not be available through the counter. Even few drugs which is such as hydroquinone, that is only available for prescription in foreign and US. It is only available in India over the counter. So, never go to a medical shop or a chemist for hyperpigmentation. It will cause more damage.
Exactly. So, normally that's the practice. We do home remedies. We'll, take help of our friend or a relative who has gone through the same plight. Then we'll go for over-the-counter medication. And then when we realize that it's out of control, that's when we land up in front of a dermatologist. And then the treatment becomes very difficult.
The train has left the station then.
Right. So please don't miss your train. Go and consult a dermatologist. Even if there is nothing, you just want to choose the right sunscreen, you can go and consult your dermatologist. Yes. Please do not go for over-the-counter medication. That can be really very, very harmful. Now, let's come to the treatment part of melasma, doctor. How do you treat melasma?
Okay, first of all about sunscreen, as I've told. So I usually prescribe a tinted and SPF 50 around sunscreen for the patient. Good cover-up, that is a face mask or a dupatta, anything. And a good wide brim hat if it is possible. Or also you can take a little umbrella also if it is possible. Then there are certain steps. There are a few layers of skin, the upper layer and the deeper layer. So the upper layer you treat it with certain exfoliating agents, which are glycolic acid or some other kind of exfoliating agents, retinol. And the deeper component is taken care by depigmenting agents such as kojic acid or hydroquinone, a very important drug, hydroquinone. but not to be used, as I suggest you over the video, only to be used through a prescription drug, because it has to be tapered, it has to be customized, tailor-made according to a patient's needs. Vascular component also there in melasma. So we can treat it with few molecules such as tranexamic acid. The newer molecule in the pipeline is this salicylic. Earlier, now also it is used for liver detoxification. Patients of liver cancer use salicylic, but it was found that patients with liver detoxification, they tend to reduce melasma. So it acts as antioxidant, salicylic and other antioxidants as vitamin C. There are also few patients which respond well to glutathione, which is also an antioxidant. These are the few modalities for treatment. But as I always say to my patients, it is not curable, it is only manageable. It will relapse, it will get back to you. You just can handle it out. Like you can reduce to a certain extent, but not completely cure.
And that makes it even more important to go and consult the expert, which is a qualified dermatologist, so they can, easily manage the whole thing. Because many a times, I'm sure your patients also ask, can melasma be permanently cured? So the answer is, doctor, no?
Yes, it is just like thyroid or diabetes.
It can be controlled.
It will stay. That is my take on it.
Okay. Fair enough. And, there are so many parlors or saloons or other, clinics where qualified dermatologists are not there, but then they offer, procedures, etc., and claim that they'll treat melasma or, work for their skin. What's your stand for those? Because parlor visits are so common in our society again. Right.
So I say, first of all, thank you for asking this question, because this is the point I want to make it to the audience. Make an intelligent decision. It is your skin. To whom do you want to go? A qualified person who has studied almost 12, 13 years to treat it, or to a salon or parlor lady. So it is totally your skin, and it is your decision, and it should be intelligent. That is my take on it.
Fair enough. And then under eye pigmentation is also very common. So what is the treatment for under eye pigmentation, and does these under eye creams, etc., do they work?
Yes, they do to a limited extent. There are types of under eye pigmentation. So there are causes. It is only due to pigmentation, hyperpigmentation, or it is due to increased vascular supply. So we need to add a cream containing caffeine, or which constricts my vessels. Or there also can be hollowness. So due to depression, the light is reflected and it is seen as depression or hyperpigmentation. So their fillers would work very well. Only pigmentation, if it is the cause, then yes, under eye pigmentation creams, depigmenting creams will work. But along with it, a good diet, sunscreen, and less screen time will also work.
Right. There are some misinformations also associated with melasma. Very common one is that people say that it is associated with age and you're bound to have this and there is no, relief from this. So what's your, how?
Yes, it is associated with age because young girls do not get melasma. Mostly like after 25 only. Few only patients have before 25, like
So yeah, it is associated with age, but if we go to and consult a dermatologist at the right time, we can definitely restrict it, and prevention is always there, and sunscreen is there to prevent it. Okay, another very common question is, can melasma turns into cancer?
Never. Short answer, never.
Okay. And, skincare routine, we say, is always very important. It's very important to take care of our skin. What is the basic daily skincare routine that we can follow? Because, of course, so many of us are leading such a hectic and busy schedules that we can't donate so much of time. But still, what are the bare minimum basics?
So, bare minimum is good sunscreen, as I have told. So first of all, you need a good cleanser according to your skin type. So if it is oily, so we can use AHA, BHA containing a good face wash. followed by a sunscreen. That is enough. If the sunscreen you're feeling it is dry, you can layer it. So you can layer first a good moisturizer, then a good sunscreen. The bare minimum for the day care routine. And for night, a moisturizer is must if your skin is oily or not a good moisturizer. Then also if there is a certain age bound factor like you are 30 or about 30, so we can use a good retinol, but just after the advice of a dermatologist. But yes, some top-ups can be given to reduce those fine lines, which can be prevented to a certain
extent. Right. And because, initially also we were discussing that how obsessed people are with, fair complexion, etc. They'll go for creams which claims of making them fairer, etc. So again, in case of melasma or hyperpigmentation, we do a lot of home remedies. People will apply curd, people will apply papaya extract. So many things are there. Is it okay to do, or these practices could be damaging to us?
So curd contains lactic acid, so it is in a very less amount. And then papaya contains papain enzyme. So these are things which we also use, but in a very regulated amount. Like I do a 10% lactic acid peel for the patient. So as few remedies are okay, few are not. You need not to scrub or rub hard over the skin. But these curd and papaya, these are all okay. But these will not damage anything. So few are okay, few are not.
But then we are not very sure of that which is okay and which is not. So for that, again, we need to go and visit a dermatologist. And as you said, just like thyroid or diabetes, etc., the treatment can go on and on and on, but it will keep a check. It will, control, or you'll feel better. So how much time, or, I'm sure patients also ask you, when am I going to be absolutely fine? So if I go early and consult you, can I be put it in a better way?
In a better way, patient definitely will be getting cured in a better way. There will be a certain reducing in darkness. Patient will get a intelligent and scientific evidence-based skincare.
Right. And doctor, before we sum up the whole session, any take-home message for our viewers? Anything that you would like to add to this topic of melasma?
Be confident in your own skin. If it is pigmented, if it is not, just a confidence brings so much of goodness and happiness. Then the other thing is melasma. Don't fuss about it. Don't panic. To a limited extent, we can treat it. We can decrease it. So instead of going to a chemist, visit a dermatologist.
Right. And that way you'll end up saving energy, saving your time, saving your money, and saving your skin, which is the largest organ of the body. And just one more thing, doctor. Is it just the appearance, or melasma could be, dangerous in other ways as well?
It's only the appearance, it is the cosmetic problem only. But these studies and many patients, they have disability quality of life index, DQLI as we call it. So they feel depressed, they feel not wanting to go to parties, not socializing, not wanting to meet people. So it is, yes, that is a factor. You can always use a good camouflage, that is the makeup, to do that. And yes, getting treated as well.
And one question from John Vargas is here, one of our viewers. Can melasma appear overnight? I went to bed, no melasma, and then woke up with melasma.
Okay, hi John, but it is not an overnight process. It is usually a good female will be able to tell you that it is not overnight process. It is a gradual process. It starts in a very few patches, and usually it increases, and pigmentation is also. It is not.
Right. And yeah, Tina is again asking, is melasma cancerous? We have already spoken about it.
It will never be cancerous.
Right, right. Thank you so very much, Dr. Milan, for your valuable time. It has been such an informative session for our viewers, and we really look forward for many more such sessions in coming times. Thank you so very much once again.
Thank you everyone. Thank you for patient listening.
Thank you. It was wonderful talking to you. A pleasure. Thank you. Viewers, thank you for your excellent participation. And for more information and updates on skin health and care, stay connected on our FB page, Beautiful Spotless Skin. We are also available on YouTube, Twitter, and Instagram. Thank you. Bye and keep glowing. Bye-bye.